Parts of the testis, we will see the coverings of the testis. Testis presents three intrinsic coverings and also extrinsic coverings. Intrinsic coverings are the tunica vaginalis, tunica albuginea and tunica vasculosa from outside to innerwards. Extrinsic coverings are contributed by the same like the layers of the scrotum and are from outer to inner, skin, dartas muscle, external spermatic fascia, cremasteric muscle and fascia, internal spermatic fascia, parietal layer of tunica vaginalis. So these are the extrinsic coverings of the testis. So we have learnt in the spermatic cord class these three spermatic fascia, external spermatic fascia, cremasteric fascia and internal spermatic fascia are derived from the three flat muscles of the abdomen, anterior abdominal wall during the descent of the testis in the inguinal canal. So this is the structure of the testis. You should have learnt in detail in the histology of the testis. Testis is divided into so many lobules by the fibrous septa. So each lobule will contain 1 to 3 seminiferous tubules. And the seminiferous tubule will be having the convoluted part in front and straight part behind. So that the straight parts will ascend and join in the mediastinum. So that's the posterior part of the testis. You can see in the image, which is on the left side is the front part, which is on the right side is the posterior part. So all the straight parts of the seminiferous tubules join in the mediastinum to form a plexiform network of tubules that will be called as the rete testis. Then from this about 12 to 20 efferent ductules will arise from the upper end of the rete testis and enter the head of the epididymis. Then the efferent ductules unite to form a single duct that will be called as the canal of epididymis. So this is about the structure of the structure of the testis. Presenting parts are very simple for the testis: upper and lower end, anterior and posterior borders, and medial and lateral, and an epididymis. So these are the presenting parts of the testis. Upper end overlapped by the head of the epididymis. So which is having the head of the epididymis, you should tell that end as the upper end. And it is connected to the epididymis by the efferent ductules. You can see the efferent ductules in the upper end. Upper end gives attachment to the appendix of the testis in the upper part. What is it? It is an embryonic remnant of the cephalic part of the Mullerian duct. So Mullerian duct, which gives rise to the female reproductive system in the female, atrophies in the male, and it is having its embryonic remnant as the appendix of the testis. Lower end is connected to the tail of epididymis by areolar tissue. So that is the lower end. Upper end will have the head of epididymis. Lower end is connected to the tail of epididymis. So you can see in this, which is upper end is having the head of the epididymis and also the efferent ductules. Lower end is connected to the tail of epididymis by areolar tissue and tunica vaginalis. Anterior border is smooth and convex. Posterior border will be broad and flat. Posterolaterally we will have the body of the epididymis. Posteromedially vas deferens. Spermatic cord will be present in the upper part of posterior border. We will see again this image. So you can see the posterior border. In the posterior border, anterior border is front, posterior border you are having the body of the epididymis and vas deferens. So that will be present in the posterior border. Medial surface will be smooth and convex. Lateral surface will be overlapped posteriorly by the epididymis, separated by a semilunar recess of vaginal sac that is called as the sinus of epididymis. So in the beginning I was telling you will be given the testis in the practical exam. How to identify the testis is, you have to see this semilunar recess in the testis, so that will be the lateral surface. So upper end will be easily it will be obvious, so you can identify it will be having the head of the epididymis. Which is medial surface and lateral surface is, you should identify this sinus of epididymis, then you should tell that side of the testis. So this is, in this you can see the testis which is having the recess, so that will be called as the lateral surface. So what is you are observing in this image is, one more thing you can observe is, laterally on the left side what is that gap is the sinus of epididymis, and on the right side you are seeing that appendix of testis, that you can note. Epididymis, we will, with this testis we will complete. It's a comma shaped and it will be present in the lateral part of the posterior border of the testis, so that it will give, will have the following parts: head, body and tail. So head will give attachment to the appendix of the epididymis. Body and tail will continue as a single duct, so that will be called as the canal of epididymis. So that will contain the canal of epididymis. From the tail of the epididymis, we will have the continuation as the vas deferens. So that is the about the epididymis. So we will, I think we should have understood this. Epididymis also. Epididymis contains this appendix of epididymis in the upper part. Testis will contain the appendix of testis in the upper part. Appendix of testis I have told. What is it? It's the remnant of the Mullerian duct. So can you identify and find out what is appendix of epididymis? These two all will be the MCQ questions till your PG entrance exams. So you should know the appendix of testis, appendix of epididymis also. So we have covered the testis in this class. Measurements, shape, size, presenting parts. In this main part which you should know is how to identify the side of the testis in the practical exam. So lateral side will have the sinus of epididymis, that will have a small gap on the lateral side, that will be called as sinus of epididymis. With that you can identify the side of the epididymis. I think we have covered this topic. We will continue with the next topic in the next class.